Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Wrench, and Carlos Saraceda is interpreting this press conference in Spanish. His interpretation will be available on the county's YouTube page and website shortly after we conclude this press conference. I have some very important and very good news to share. Governor Newsom announced today he is advancing the timetable for reopening California businesses. This Friday, Governor Newsom will begin easing his stay-at-home order and allowing the reopening of some businesses across the state of California, specifically retail businesses for pickup and drop-off. Reviewing the 6 preconditions the governor identified to control the reopening of businesses in our county, 4 of the criteria apply directly to the County of Santa Barbara's Public Health Department. Number 1, the ability to test and contact trace and support exposed patients. The Santa Barbara County Public Health Department is currently able to support the testing, contact tracing, isolating, and support criteria established by the governor to move forward to the next phase. We are confident that over the next several weeks, we will have additional capacity to fully support expanded contact tracing and will bring on more trained staff to do this important job. Dr. Del Reynoso will be reporting on these critical indicators at the Board of Supervisors meetings tomorrow. Number 2, the ability to protect those at risk for COVID-19. The Santa Barbara County Public Health Department has developed the necessary reporting systems and intervention strategies to protect people who are particularly vulnerable to COVID-19, like our frail seniors in skilled nursing facilities, group homes, and senior retirement communities. In addition, we have continued to work to provide support to the county's unsheltered population. Number 3, the surge capacity of hospitals. We continue to have sufficient hospital capacity, staffing, and protective equipment at all our local hospitals to protect against future positive COVID-19 patient surges. Number 4, the ability to develop new therapeutics for COVID-19 is not an issue within the purview of the County of Santa Barbara's Public Health Department. The development of new medical treatments and potentially a vaccine for COVID-19 is a challenge for every medical research facility in every country in the world. Number 5, the ability for businesses, schools, and child care centers to support physical distancing. This will be addressed through guidelines the governor plans to release this Thursday, and these state guidelines will be further refined through the county's Business Recovery and Reopening Task Force process. Finally, number 6, based on indicators, the county's public health officer is fully prepared to reinstate more restrictive public health orders if the need arises to protect our community from future COVID-19 virus outbreaks. In summary, Santa Barbara County has been tracking indicators to meet the public health criteria the governor outlined for reopening our county back to business. We will be closely reviewing the criteria to be set forth by the governor this week and referenced in his press conference remarks today, to make final determinations on how best to move forward on his new timetable. Later today, the California Department of Public Health will be sending additional guidelines to county public health departments around the state to provide more details on the specific guidelines the governor will be releasing on Thursday. The county's Business Recovery and Reopening Task Force will continue to meet this week to very quickly define the specific operational issues each business will follow to ensure the protection of its employees and customers. We are moving as fast as we can to meet the new timetable the governor announced today to begin operating businesses again. As the governor described it, the new timetable is a very positive sign because the data says this can happen. The governor acknowledged the regional variations and diversity around the state and the hard work that local governments have done to position our state and county at this new phase. We will continue to work closely with the governor's office and the California Department of Public Health to make sure that the health of every resident in the county continues to be protected and at the same time begin to reopen our economy and get local residents back to work. Going into the weekend, there was a lot of concern about what might happen with crowds at our local beaches. I went to see for myself on Saturday and again on Sunday, and I was very impressed. I visited most of the public beaches from Goleta to Rincon, and from what I saw, people were out enjoying the beaches safely. Crowds were very manageable, and people were keeping large distances from each other on the sand. Reports from the sheriff's mounted patrols and park rangers confirmed my observations. There were no reported issues at the beaches. I also continue to see more and more people wearing masks while shopping in grocery stores throughout the South Coast. Each of us are doing our best in our own way to contribute to the united community response to COVID-19. As I mentioned last week, we all need to continue to rigorously practice personal hygiene and physical distancing as we go forward. The commitment we made together to protect each other these past 6 weeks has worked, and we will soon be entering the next phase together. The very good news the governor shared today does not in any way change the imperative we each share to continue to do the right thing and continue to look out for each other. The virus is not gone. Positive COVID-19 infections will continue, and we must all do everything we can to limit the spread of the virus during the opening of businesses in Santa Barbara County. Please continue to follow these 3 simple rules that we are now a regular part of our lives. Number 1, please stay home as much as possible. When you go out, wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands, don't touch your face, and disinfect surfaces regularly. Number 3, if you feel sick, isolate yourself at home. If your symptoms worsen, call your doctor or clinic and follow their medical advice. A few weeks ago, I spoke about the amazing work of Women's Economic Ventures in assisting small businesses in our community. Under the leadership of Kathy Odell, Women's Economic Ventures has made approximately $400,000 in low-interest emergency loans available to businesses in need since the start of the pandemic. These loans, which provide up to $10,000 per small business, are designed to provide a bridge to help small business owners as they apply for other assistance programs and navigate modified business operations or temporary closures. In addition to providing loans, Women's Economic Ventures has been hosting virtual meetups to discuss various challenges that businesses are facing and to assist local businesses in accessing the state and federal assistance programs that are available. All of this is possible because of the generosity of our own community. The Santa Barbara Foundation and Ventura County Community Foundation each provided $125,000 to support this emergency loan program. Many other community organizations and individual donors have also provided support. To learn more about this program or to learn how you can help, please visit wevonline.org. That's wevonline.org. For more information about the county's economic recovery efforts, please visit readysbc.org/economic recovery. That's readysbc.org/economic recovery. We'll now hear from Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Today we are reporting 12 new cases of COVID-19 in Santa Barbara County. We now have a total of 526 cases. Of the total cases, 65 are recovering at home, 39 are hospitalized, with 13 in the intensive care unit. We are pleased to share that 404 people have fully recovered. Governor Newsom and the state health officer earlier today announced a plan to start a phased and safe opening up of our economy by the end of this week on Friday. This is a direct result of all of our efforts in mitigating the spread of the virus through our physical distancing. Very specific metrics or readiness parameters will have to be fulfilled on a local level to allow the gradual opening to happen. We continue to encourage our community to practice physical distancing, wear a face covering when possible, and continue with thorough hygiene measures. In addition, we understand that many people are wondering about graduations and proms at this time of the year. Due to the nature of these events, they will likely not be able to proceed in a traditional format. We are currently awaiting input from the State Health Department on this issue, and will give you clear guidance in the near future. I thank you for your continued commitment to flattening our local infection curve. Please stay the course as we work to transition to the next phase in the coming days and weeks. Thank you all.
Thank you, Dr. Ansberg. I'd now like to introduce Dr. Vonda Reynoso, the county's Public Health Director.
Thank you, Supervisor. Good afternoon. We are excited that tomorrow will be our first day of COVID testing at the community-based testing site in Santa Maria. So it'll be at the Santa Maria Fair Park. Additionally, greater access will come to Santa Barbara County later this week as sites are opened up in Lompoc and Santa Barbara. At this time, all 132 appointments for the first testing have been filled, and the rest of the testing schedule is quickly filling up. We encourage our community to take advantage of this local opportunity to be tested. This service is here to meet the need of every community member, regardless of preferred language spoken, regardless of immigration status, regardless of insured or uninsured, and anyone experiencing homelessness. These test sites are here for everyone. Screening and testing appointments can be made by visiting lhi.care/COVID testing or by calling 1-888-634-1123. Again, that's 888-634-1123. The test will be free of charge or billed to health insurance where available. Appointments are required for testing. So the other side of community testing is contact tracing. So we have 4 teams stood up, as Supervisor Hart mentioned, and that is disease investigation, contact tracing, contact monitoring, and isolation and quarantine. We have core teams existing of nurses, county staff, and community members. And we'd like to bolster our team further with additional nurses, and these can be nurses who can work remote or in the community. We're still looking for some medical assistants, some drivers, and general operation support. And we always will welcome volunteers to join our efforts. More information will be posted on our website shortly. Thank you.
Thank you, Dr. Reynoso. I also invited Nancy Gottlieb, who is the Clinical Director for the Council on Alcoholism and Drug Abuse, to join today to talk about the constraints that they have been operating with the COVID-19 pandemic. Even so, CADA is continuing to provide countywide support and recovery services to create a safer, healthier community by preventing and treating alcoholism and drug abuse. Welcome, Nancy.
Thank you so much, Supervisor Hart. So I'm here to provide information and words of encouragement for all of us who have been impacted by social distancing and all the worries that have come with this COVID-19. We have worries about our health, finances, school, childcare. We have to be all things to our children now. All of the events that have been canceled, I can't imagine going through school and not being able to have your graduation or prom. This has led to feelings of anxiety, depression, anger, and these feelings impact behaviors, and no one's immune to feelings. I just want to say we're all human. So you may find yourself acting and feeling in ways that are unfamiliar or maybe even unhealthy, and these can lead to behaviors that are unhealthy, such as self-medication. And self-medication happens when you wind up using drugs or drinking or smoking pot more than you planned or more than you wanted to. And so we want people to be alert to that and to let you know that CADA, the Council on Alcoholism and Drug Abuse, is open, and we're offering services via phone and telehealth from 7 a.m. to 9 p.m. And those services are available to adults and adolescents and to families, and we provide support services throughout Santa Barbara County. Our staff are trained in both substance abuse and mental health services, and we can find resources for your family, and we welcome calls from family members and parents to provide support. Telehealth sessions can be individual, groups. You can call and get one session. You can talk to someone daily. We also work to connect people to resources in the community. And if you're not technically inclined, our counselors will actually attend technical 12-step meetings or Zoom meetings with you and help you walk you through that program. We're providing incentives to adolescents who participate in groups in order to give them incentives to continue to stay in treatment. And so if these services are all free if you have Medi-Cal, you call the access line. That line number is 888-868-1649, 888-868-1649. Or you can call CADA's main number, which is 805-963-1433. And CADA does accept many forms of private insurance. So we hope to hear from you, and we want you to know you're not alone. Help's out here. And we hope that you'll reach out.
Thank you, Nancy, and thank you very much for all the important work that Kate is doing for our community.
It's our pleasure.
We'll now go to
And
questions
privilege.
from the room. Ms. Lair?
Thank you so much. About that gradual opening, could I get the doctors as well as Greg Hart to say what will that look like? Because if he's saying Friday, can you go and pick up flowers delivered to your car on Friday? Or can you just explain, is it going to happen Friday, or we still have to get over some hurdles? If the three of you could comment on what you envision it to be, I'd appreciate it.
Well, the governor announced today that he will be giving new guidance to the Public Health Department today, later today, and then he will be releasing additional guidance for businesses on Thursday. So in the time between now and then, we're going to be working collaboratively with the governor's office and the Department of Public Health to better clarify exactly what will and won't be allowed. But the description that the governor used today at the press conference was retail businesses for drop-off and pickup. He gave a relatively small number of businesses that he described in his press conference, but we expect to know more details either later today or Thursday in time for businesses to open on Friday.
Could you both comment on what you
Yes,
envision?
I concur with everything the supervisor just mentioned.
But what kind of things do you envision opening and when? Even if there is a date, what kind of things would you get at the curb?
So we're really following the state's guidelines. I believe that CDPH will be releasing their guidance Thursday. So we will be following the guidance and supplying the metrics and the indicators that will be needed for us to get to that stage.
So that means nothing will open on Friday.
No, we, as Supervisor Hart just mentioned, I believe on Friday, retail for drop-off and pickup will be available. The specific retail will be released, as well as the manufacturing and the logistic chain to support those retailers will be allowed insofar as they meet the criteria for safe distancing protocol and risk management.
Do you want to add anything to that, Dr. Ansel?
Well, the State Public Health Department categorizes businesses in low risk, medium risk, and high risk. And in the first or in the second stage now of opening, only low-risk businesses will be allowed to open in a measure that Supervisor Hart and Director Do Reynoso just outlined. So there's a short list of flower shops, clothing retailers, shoe stores, things like that are considered low-risk environments to spread the virus. However, in the beginning, it will only be done with curbside pickup.
And finally, tomorrow's Cinco de Mayo, and I just thought it gives Kata a chance to say something on that note.
Well, we hope people will be safe and reach out. There's lots of ways to celebrate with your family members through Zoom and other technological means. I think it's important to reach out to families and friends and to stay connected and to do it in a safe way that doesn't expose anyone or run the risk of exposing anyone.
Thank you.
Thank you. Are there any questions on the phone?
Yes. Laura Place with Santa Maria Times. Go ahead.
Hello. Regarding the testing site opening tomorrow, I know in the announcement sent out by Public Health, they said that hours for each day would be announced depending on need. Is there a set schedule for this week for hours that it'll be open?
You know, I don't have that information, but it will be released shortly after the press conference.
Okay.
We'll make
thank
sure
you.
that
And then
that gets posted on our website as well as in the press release.
Okay, thank you. And then a second question just regarding the business task force and reopening plan for the county. It sounds like with the tight turnaround, trying to get criteria figured out for Friday, there won't be time for stuff like community feedback on the plan. I know that's something SLO County was implementing. Is community feedback on a reopening plan something that Santa Barbara County is considering too?
Yes, the county's plan does include a timetable for public input into the specific guidelines that each business would operate under. Of course, we're trying to go as quickly as the governor is giving authority to open businesses. As Dr. Anzorg and Dr. De Reynoso described, the first phase that he is authorized opening on Friday is a relatively limited number of businesses. So we're going to continue to move forward with the Recovery and Reopening Task Force and the specific guidelines that they are developing for specific industries, anticipating that as the governor moves forward with additional phases, that those guidelines will be important and necessary for those new additional businesses to be opening. The governor also described that there is going to be a process where counties will be able to self-certify achievement of public health indicators and milestones, and that self-certification process will allow for other businesses beyond the initial statewide limited list of businesses to be opened in time. And we want to be prepared in advance of that and want to have the Reopening and Recovery Task Force weigh in on all those issues and want also the public to have a chance to comment. That being said, we all want to go as fast as possible so that the opportunities for public input will be constrained because we want to go fast.
Okay, thank you.
And next up, we have Reza with San Ynez Valley Star.
Hi, I have two questions. This past weekend, there were several rallies in several areas, Santa Maria and Falvang, and there were people out at these rallies not wearing face masks. And they've received some kind of criticism specifically on our social media sites. And I had remembered Dr. Henning Anzorg, you had said last Friday that the masks, when worn outside, are not scientifically proven to actually prevent anything. And I wanted to know if you could elaborate on that. I'll just start with that one.
The masks are intended to protect other people from exposure to respiratory secretions from droplets. So they're most effective in a closed environment like a store, and they're most effective if people cannot safely maintain physical distancing. So if somebody was to go on a walk outdoors and there's nobody around, there is really no reason to wear a mask.
So if, let's say, these people were at, this rally, or if there's a, group of 10 people or more, and they're 6 feet apart, would they have to wear a mask?
Well, I don't recommend to go on any rallies at this point, so that sort of defeats the purpose of the stay-at-home order. However, outdoors is always safer than indoors just because of the improved ventilation.
Right. But I've also been seeing people wearing masks while they're driving in their car by themselves. Is that recommended?
It does not serve any particular purpose, honestly.
Okay. And then my second question is that we've had some reports of local businesses that have opened up already, kind of defying Governor Newsom's order. And I wanted to know if Santa Barbara County would be enforcing closures of those businesses if they were reported.
The governor spoke to that at his press conference today and said that there are state regulatory agencies that will investigate the opening of businesses that are not appropriately authorized to open at this point in time, particularly the Alcohol and Beverage Control Department and other public health agencies at the state level. The preference is for everyone to be patient and to follow the direction that the governor has provided and the pathway to legally open businesses. We have not heard a lot of reports. In fact, I'm not aware of any reports of businesses that have been opened here in Santa Barbara County in violation of the governor's order. But the path forward, beginning on Friday, that will be more clear with additional guidance from the governor, I think gives everybody a great sense of optimism that we will soon have more businesses open and more opportunities for people to get back to work.
Maybe I need to be more specific, but what is Santa Barbara County's position on that? Would you be enforcing fines or any, actual closures?
We're doing public education, going to those businesses, explaining the specifics of the governor's order and asking them to voluntarily comply.
Okay, thank you.
Next up, we have Melissa Newman with KSBY.
Hello, I have some questions in regards to the contact tracing. You guys mentioned the increase in staff. Just wondering how quick that turnaround notification is for folks that may have been in contact, if that turnaround will be even faster with the increased staffing, and if it was true that law enforcement would get involved if someone does break their quarantine after being notified they may have been in contact.
So with regards to a person testing, how quickly will they get the results? We are anticipating that they'll get the results within 2 business days. Once the Public Health Department receives the notification, we are anticipating to do the contact tracing within 24 hours. We have had a lot of success with contact tracing, isolation, and quarantine. We have a seasoned team of public health professionals who will continue the practices that have been successful, which is really engaging the patient to comply with the quarantine order. So our best strategy has always been to reason, to educate, and to engage the patient in realizing the critical nature of the quarantine. And that will be our approach still.
And so law enforcement wouldn't get involved if they did leave their quarantine too soon?
So in the past, we have had to engage law enforcement to support us with quarantine orders. Yes.
Okay, and if someone is interested in applying to be a part of this new task force with contact tracing the governor announced today, is there certain things that make someone qualified, or can anyone really volunteer to help?
So we have certain positions that will require clinical degree or at least clinical training. And then we have just general people who are interested in supporting this effort. On our website, soon to be released, will be the job description for each of those roles and a short, brief application for anyone interested in joining our efforts.
Okay, thank you.
Thank you, Melissa. That concludes the questions.
Our next press conference will be held Wednesday at 4:30 p.m. Tomorrow morning at 9 a.m., the Board of Supervisors will be hearing a presentation from the Public Health Department about the COVID-19 pandemic and our response. Thank you for joining us today.